Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we can discuss questions for RRB staff nurse exam, also ESIC, DSSSB, insurance medical service, Kerala PSC exam, DME exam and JPHN exam. First question we can see, signs and symptoms of which of the following would be priority when caring for a newly delivered term neonate diagnosed with small 4 gestational age. And our options, first option birth asphyxia, option B iron deficiency anemia, option C persistent pulmonary hypertension, option D hyperglycemia. Here the question is, a term baby delivered or diagnosed with small 4 gestational age. While caring the baby, which is the priority signs and symptoms we will focus, okay, while doing care. Small 4 gestational age means the intrauterine growth is less than normal according to the gestational age. Okay. So in this baby, while doing assessment, we can find that baby having birth asphyxia or fetal distress and decreased or elevated body temperature, hypoglycemia and signs of infection and signs of aspiration of meconium. So we have to focus on the basis of signs and symptoms which the baby have. Here option A, birth asphyxia is the priority care for a baby with small 4 gestational age. And the next question, most commonly affected valve in rheumatic heart diseases. Options, option A tricuspid valve, option B aortic valve, option C pulmonic valve, option D mitral valve. The valve which is most commonly affected in rheumatic heart disease is option D mitral valve. And the next question, which heart disease is commonly associated with rubella infection? Option A patent ductus arteriosus, option B ventricular septal defect, option C atrial septal defect, option D coarctation of aorta. Rubella or German measles is an acute infection in childhood. If it occurs in early pregnancy, it may result in serious congenital defects that include deafness, cardiac malformation and cataract. Here cardiac malformation, the heart disease commonly associated with rubella infection is patent ductus arteriosus. Option A is the correct answer. And the next question, while taking vital signs of a child with coarctation of aorta, nurse should suspect. Options, option A weak rapid pulse, option B a strong pedal pulse, option C a decreased blood pressure in the arm, option D an elevated blood pressure in the arm. Coarctation of aorta means narrowing of the aorta, usually occurs in the thoracic part, which may result in accumulation of blood above the constricted part or narrowing part, so that increased blood volume and pressure in the arm can expect in this case, because narrowing most commonly occurs in the thoracic part, okay, and decreased blood volume and pressure can noted in the legs. So the correct answer for this question will come option D, an elevated blood pressure in the arm. Why? Because the narrowing usually occurs in the thoracic part, so the blood pressure and volume will increase in the arm or arms. And the next question, while taking temperature from rectal route in children, thermometer should be inserted about. Options, option A 0.5 inch, option B 1 inch, option C 2 inch, option D 3 inch. And the correct answer is option B 1 inch. If oral and axillary method is contraindicated, then we can use rectal method or rectal route for taking temperature. Here, for taking temperature, the thermometer should be inserted about 1 inch. Option B is the correct answer. And the next question, granulomatous orchitis is the term applied for inflammation of. Options, option A ovary, option B prostate, option C lungs, option D testis. Orchitis is the inflammation of testis. Granulomatous orchitis means it's an inflammation of testis. Option D is the correct answer. And the next question, when a nurse performing a surgical hand hygiene, she must keep hands. Option A above elbow, option B below elbow, option C at 45-degree angle, option D at comfortable position. While performing surgical hand washing, she must keep the hands above the elbow level. Option A is the correct answer. The surgical hand wash time is about 3 to 5 minutes. When washing hands, the hand should hold above the level of elbow because the elbow are considered more contaminated than hands. So the water should run from least contaminated area, that is the hands, to the more contaminated area to elbow. The next question, after giving BCG, scar get formed in options. Option A 2 weeks, option B 3 days, option C 3 months, option D 2 months. BCG means Bacillus galmaticae is a live attenuated vaccine which is given for tuberculosis. The dose is 0.1 ml and the site is intradermally given through tuberculin syringe. Our question, the scar get formed within 3 months. Option C is the correct answer. Usually the scar formed within 6 to 12 weeks or 3 months. If the option 6 to 12 weeks is there, means that is the correct answer. Here 3 months is there, so that will come correct. After vaccination, that means 2 to 3 weeks after intradermal injection, a small papule will develop at the vaccination site. Okay, then slowly its size will increase and reaches about 4 to 8 mm diameter. The papule size will become little big, that is 4 to 8 mm in size. This is usually at about 5th week. Then it subside and break into small ulcer. Okay, and form a crust and leaving a permanent scar within 6 to 12 weeks. And the next question, vector of Kala Azar is options. Option A housefly, option B testis fly, option C sandfly, option D mosquito. Vector of Kala Azar is sandfly. Option C is the correct answer. And the next question, ear ossicles are made up of options. Option A hyaline cartilage, option B fibrocartilage, option C elastic cartilage, option D none of this. Ear ossicles are made up of option C elastic cartilage is the correct answer. Ear ossicles are malleus, ingus and stapes. They are made up of elastic cartilage. And the next question, the epithelial tissue which lines the urinary bladder is options. Option A simple epithelium, option B stratified epithelium, option C transitional epithelium, option D squamous epithelium. The epithelial tissue which lines the urinary bladder is transitional epithelium. Option C is the correct answer. And the next question, drug of choice in mushroom poisoning is options. Option A atropine, option B neostigmine, option C physostigmine, option D epinephrine. Drug of choice in mushroom poisoning is atropine. Option A is the correct answer. And the next question, which of the following drug is used to prevent the blood clotting during hemodialysis? Option A heparin, option B protamine sulfate, option C warfarin, option D all of this. Question, which drug is used to prevent blood clotting in hemodialysis? It is heparin. Option A is the correct answer.